everyone, welcome to See and Perceive section. I will be talking about antiseptics and disinfectants. The topic is arranged under following headings: antiseptics, decontamination, disinfectants. So let us begin with the definitions. Sterilization: freeing of an article, surface or medium by removing or killing all microorganisms including vegetative form of bacteria, spores, viruses, fungi. Disinfection: destruction or inhibition of growth of all pathogenic organisms like bacteria, viruses, fungi on non-living surfaces. If spores are also killed, the process is known as sterilization. Disinfectant: it is a germicidal chemical substance used on the inanimate objects to kill most recognized pathogenic microorganisms, but not necessarily all microbes. Definitions: antisepsis: it is the process of destruction of disease-causing microorganisms to prevent infection in patient's body surface. The process may be bactericidal or bacteriostatic. Antibiotics: any variety of natural or synthetic material or chemical that inhibits growth or destroys the microorganisms. Properties of good antiseptic or disinfectant. The properties of good antiseptic or disinfectant are as follows: cidal in nature, non-staining and good odor, active against all disease-causing microorganisms, active in presence of pus, blood and exudates, rapid acting, non-irritating to tissues or non-corrosive, non-absorbable, non-sensitizing. Mechanisms of action of antiseptic and disinfectants. Oxidation of bacterial protoplasm. For example, potassium permanganate, H2O2 halogens. Coagulation or denaturation of bacterial proteins and disrupt cell membrane. Phenols, chlorhexidine, alcohols, aldehydes. Detergent-like action increases permeability of bacterial cell membrane. Cetrimide, soaps. Antiseptics: these are chemical substances which stops the growth or kill microorganisms on living surfaces such as skin and mucous membrane. Strengths of chemical and their actions for equipment and supplies. This is the table showing strengths of chemical and their actions. Cleaning and disinfection of various items. This is the table showing cleaning and disinfection of various items. Glass items. Disinfect the items by immersing in 0.5% chlorine or sodium hypochlorite. Chlorhexidine solution minimum for 5 minutes in plastic container covered with lids. Rationale is to decrease the number of microorganisms on the surface of the item. Scientific principle is chlorine kills many microorganisms by releasing free oxygen. Next, enamel wares. Immerse the items in a chlorine solution of 0.5%. Rationale is to disinfect, and scientific principle behind is disinfection can kill most of the bacteria and viruses like hepatitis B virus, HIV. Next is stainless steel items. Always immerse in 0.5% of chlorine solution for 5 minutes. Rationale is to disinfect. Scientific principle is disinfection destroys many of the pathogens. Next is needles. Decontaminated all types of needles attached to syringe and flush with 0.5% chlorine solution or chlorhexidine or sodium hypochlorite immediately after use The rationale is to render the article safe for use. The scientific principle is to decontaminate and make the article. Availability. Next is protoscope and bronchoscope. Immerse both obturator and speculum in a 0.5% chlorine solution, minimum for 10 minutes. Then rinse in water, boil for 10 minutes. Then send for autoclaving. The rationale is to decontaminate, and scientific principle is to decontaminate and make the article available for use. Next is sharp instruments. Immerse the sharp instruments in a 0.5% chlorine solution or in 2% glutaraldehyde for 20 to 30 minutes. Add anti-rust agents, example sodium nitrate, 0.1% if available. The rationale is to disinfect and sterilize the instruments. The scientific principle is disinfection destroys many of the pathogens. Next is laryngoscope. Detach the blade separate and immerse it in a 2% glutaraldehyde solution for 20 to 30 minutes. The rationale is to decontaminate, and scientific principle is by decontaminating we can make it ready for next use. Commonly used skin disinfectants and antiseptics. Biocides, alcohols like ethanol, isopropanol or N-propanol. Most commonly used dilution is 60 to 95%. Povidone iodine solution or betadine. Iodine tincture IP 5%, alcohol 65%. Uses pre-operative painting of skin. Special considerations. Iodine should be wiped up with spirit after 2 minutes of painting skin. Idiosyncrasy, unusual feature or odd habit or quirk, may occur in sensitive patients. Alcohol increases the permeability of the iodine. Savlon decreases the iodine's efficiency due to its detergent action. It kills 90% of skin bacteria in about 90 seconds of application. Hydrogen peroxide, H2O2. Properties and effects. It is a cleansing agent, not an antiseptic. Mechanism and uses. It destroys anaerobic organisms and that such if used for cleaning the wound infected or contaminated with anaerobes. It produces frothing and brings out debris from the depth of the wound. It produces heat when it comes in contact with the tissues. Thus, it prevents capillary oozing and hence it is used as hemostatic solution whenever there is capillary oozing. It is used in cleaning wounds, bleaching, boils and as a mouthwash and throat spray. Very diluted form is used in ear syringing to remove wax and foreign body. It is used to remove blood stains from clothes. Spirit. Composition is alcohol 70%. Uses. Disinfection of skin before intramuscular and intravenous injection. Removal of iodine in preparation of skin for operation. Cleaning the stitched wound. Cleaning the skin that surrounds ulcer or open wounds. As it dissolves the greasy material, 50% spirit in water is used as ear drops. Used along with other disinfectants such as iodine spirit and cetavlon spirit for painting the parts before operation. Ether. Properties are it is evaporable, highly inflammable, it makes the surface cool. Uses. It is used as inhalation and surface anesthesia. It is used to clean the dirty skin as it removes the greasy substances by dissolving them. Gentian violet. Concentration is dilution of 1:100 and 1:1000 are generally used. Properties and effect. It coagulates the serous discharge on oozing surface and makes the ulcer dry. Use. To dress eczema lesion with copious seropurulent discharge. Adverse effect or disadvantage is it colors the ulcer, so the progress of healing becomes difficult to judge. Potassium permanganate. Properties are it has oxidizing effect and it is available in crystal form. Concentration 1:5,000 or to 1:10,000 solution is made with water. Uses. It is used as mouthwash. It is used for urinary bladder irrigation and wash. Sometimes in SIDS bath. Silver nitrate. Concentration. Solution with dilution ranging from 1:100 to 1:1000 are available. Special consideration. Impregnated cotton sticks are kept in dark container because on exposure to light, silver nitrate gets destroyed. Antiseptic techniques. Apply liberally the diluted solution on the surface of articles to be disinfected with clean swab or cloth. Store sterile instruments by immersing in the diluted solution up to 8 hours. Rinse with sterile water before use. 1:100 aqueous solution. Uses. Disinfection of wounds and burns, skin swabbing in obstetric patients, washing of hands and scrubbing. Antiseptic technique. Apply the diluted solution properly on the surface to be disinfected with a sterile swab. Chemical cauterization of warts and hypergranulation tissue. Used for dressing burns, useful in bladder irrigation in cases of hematuria due to its cauterization effect. Hibitane concentrate. Composition, it contains chlorhexidine gluconate, that is 5%. Color is red. Dilution 1:250 aqueous solution. Uses. Disinfection of furniture, equipment and fitting in the vicinity of the patients. Storage of sterile instruments. Care of antiseptic solutions. Do's. Always dilute concentrated antiseptic solution before use as directed. Always prepare dilution in small volume, preferably not more than 1 liter. Always use all diluted solutions within 8 hours and discard the remaining solution. Always ensure that the mouth of the bottle is not touched by hands or material while pouring. Don'ts. Mix up old diluted solutions with the freshly prepared ones. Leave diluted solution for more than 1 working day. Use corks for sealing the bottles. Leave bottles open. Biomedical bin solution preparation. PGINER guidelines. Bleaching solution 1%. 15 grams ratio 1 liter. 75 grams 5 liter. 150 grams ratio 10 liters. 300 grams ratio 20 liters. Carbolic lotion 5%. 5 gram ratio 100 milliliters. 50 grams ratio 1000 milliliters. 500 grams ratio 10 liters. Hypochlorite solution 4% to make 1:1. 25 ml ratio 75 ml. 250 ml ratio 750 ml. Thank you.